everybody. Welcome, everybody. Today, we are here with our very esteemed special guest, Dr. Michael Klaper. And I'm going to introduce him in 1 second. But while we're waiting for everybody to come in, please let us know where you're coming in from. We've got people from all over the country that usually come in to watch these things. And we can't wait to get as much knowledge as we can from Dr. Klaper, who's now in Canada, and I'm in Colorado. So, and we have Dr. Niki Davis, who's also joining us in just a couple. There she is.
Hey.
Hello.
So we've got Dan from Walnut Grove. We've got Judy from Monmouth, Illinois. Jeffrey from Philadelphia, Pennsylvania. Yay! All right. Well, we have a lot to talk about. So let me introduce the person that really doesn't need an introduction, but this is Dr. Michael Klaper, who's graduate from the University of Illinois College of Medicine in Chicago. He practiced acute medicine, care medicine in Hawaii, Canada, California, Florida, and New Zealand. And for the past 35 years has been focusing upon health promoting food and lifestyle choices to help reverse disease and prevent the need for hospitalizations and surgeries. He's a diplomat of the American College of Lifestyle Medicine, served as nutrition advisor for NASA. So we've got 2 NASA people on here for space colonists on the moon and Mars. I feel left out because I'm just an earthling, but this is awesome. At his website, drklaper.com, visitors can find practical insights into nutrition and healthy living through his numerous articles and videos, and subscribe to his free newsletter, Medicine Capsule. Currently, he's on the staff of, and I'm not sure I'm going to say this right, Aroga Lifestyle Medicine Clinic in Victoria, BC. His passion is for his nonprofit called Moving Medicine Forward Initiative. You can find that at movingmedforward.org, and that teaches medical students about reversing chronic disease utilizing plant-predominant nutrition. Welcome, Dr. Klaper. It is an honor, as always, to have you in our presence.
Thank you, Kim. And great to see you, Dr. Davis. Lovely to be here. That's a great intro you guys got. That's a really lively video.
We had some good.
Well done. Yes.
Thank you. Well, it was so good to see you, Dr. Klaper. We've missed you. You know, we used to get to see you a lot more often, but we will take what we can get.
Yeah. I wish you guys
All right.
too.
So we would love to just I think we want to just kind of get some updates on, from like what you've been up to lately. And you got a little bit of pieces in your bio, but why don't we start with kind of what life has been like for you where you're working currently? So knowing that you've worked in both the US and Canada now, how would you describe the biggest cultural or systemic difference in how telehealth is practiced?
Oh my, great question. So how did this come about? My wife, Elise, has basically her only family. The oldest nephew, Peter, married a Canadian woman up here in British Columbia, and they have a nice farm up in Qualicum Beach, north of Victoria. And we were up visiting them. And a dietitian friend of mine said, "Oh, if you're on Vancouver Island, you ought to go down and see the folks at Aroga Clinic in Victoria. They've got lifestyle medicine there. There's a really happening place." So indeed, I went down to Victoria and met the doctors at Aroga Clinic, Aroga. What name is that? It's a Sanskrit name. The founding 3 internal medicine physicians of the clinic are Sikhs, the lovely men who wear the turbans, excellent clinicians, and they're all Canadian guys, but they are the Sikh beliefs. And I asked about the name, and they said it's a Sanskrit word, roga, R-O-G-A or R-O-G-Y-A, rogya. In Sanskrit means a blemish, an illness, an imperfection. So aroga is no blemish, it's perfect health, blemish-free health there. So that's where the name came from. And they are fully on board the lifestyle medicine train. They've been here for 10 years, and just about as long as the American College of Lifestyle Medicine. And they really have their roots in the community. I asked, where do you get your patients? And they said, well, we've got more patients we know what to do with. We're on great terms with the Victoria medical community. The cardiologists send us their patients, the gastroenterologists send us their patients, the rheumatologists send their patients, because we reverse their disease. We get them healthy. And all the doctors are so loaded up. The government pays for the health care here. There's never a bill to the patients. But meanwhile, there's waiting lists to be seen by your doctors. So any physicians in the community that can reduce the burden of patient load on the other doctors, they're all for it. And that's exactly what we do. Lifestyle medicine reverses these diseases, of course. And so you asked about how telemedicine is used. Because of my telemedicine experience with Love Life and plant-based telehealth, and we all work together, I'm very competent doing telemedicine consultations. They hired me as director of telemedicine services, and I'm a busy guy. They really use telemedicine a lot. There's a lot of patients, say, who live up kind of way up Vancouver Island or in the interior British Columbia. They're never going to come to Victoria. So they're my telemedicine patients exclusively, or patients that are seen once in the clinic, but then need follow-up. I follow up with them. But as you know, I love to teach. And so they appointed me one of the chief instructors. And every patient who joins the Aroga Clinic, it's strongly recommended, with a wink there, as a mandatory, but it's strongly recommended that that every new patient enrolls in their 8-week course in the fundamentals of lifestyle medicine, a week on plant-based diets, a week on exercise, sleep, stress reduction, etc. And I teach all those courses to quite a number of the new patients, to about 50 to 60 new patients every 8 weeks. I teach them the course there. And then I do telemedicine drop-ins where they say, Doctor, it's nice for you to do this 8-week course, but meanwhile, in the real world, we have questions. How do you shop? How do you deal with a husband who isn't on board? Real world issues there. So every other week, I'll do a telemedicine drop-in clinic for those kind of people. We want to keep the energy going. And there's a wonderful program called the Teaching Kitchen, which we are going to be setting up, because I'd like to do live plant-based teaching in the Victoria community. Find a commercial kitchen somewhere and open it up to the general public and put plant-based food in their mouths. A taste is worth 1,000 words. And that's going to generate more interest. The local news will cover it. It's going to get the energy moving in the community for plant-based, but also just lifestyle medicine. So I've got a full plate, so to speak, but I'm really enjoying it. The Canadians live up to their stereotype. They are lovely people. They are so polite and so helpful. Everybody from the gas station attendant to the lady at the dry cleaners, they really, they're fully present when you walk through the door there, and they want to be truly helpful. They are just lovely people. Current political situation aside, but I really enjoyed being in Victoria here. And again, the work that I'm doing with the Aroga Clinics is just a tailor-made fit for who I am in my career at this point. So I'm really enjoying it very much. And I'm here on a 3-year work permit. I'll have my option either to renew it or return back to the States and do something else. But right now, it's just a great fit. So I'm enjoying being in Victoria. And it's a lovely city. It's a small, walkable city, symphony orchestra, ballet, film festivals, jazz clubs. My wife's a jazz singer. And so we really enjoy just living in Victoria. A little chilly in the winter, but other than that, it's just a great chapter in our lives, really enjoying it.
Wonderful. Well, I mean, it just sounds like such a dream clinic to have all of that support. I mean, Teaching Kitchen and, having a program that everyone can go through to really learn the basics of lifestyle medicine. I mean, I wish so badly that we could create something like that in the United States that would work as well as what you guys are doing. And I think it sounds like, because it is government funded, And it makes sense for these clinicians to refer their patients to you guys because it helps take off, from their plate of already being busy, that it really works well. And I just think that, is the reason that we can't figure out a way to really get something like that working really well here, because it's all for profit, I don't know. What do you think?
Oh, that's, those are the two words. It's a for-profit system, and that poisons the system as far as I see. Everybody's got to make money off every aspirin, that's dispensed there. Well, the prices are going to go way up, and the insurance companies step in and with their rules, et cetera. It turns into this grotesque obstructionist assembly of rules and frustrations. The Canadian medical system is not perfect here in British Columbia. It's just it's underfunded. There's too few doctors. They don't pay them enough, and so there's long waiting lists. But the wheels turn. I've referred patients to specialists and to MRI scans, whatever, and they get scheduled and they get seen, and the scans happen. And it's just a joy knowing that. After I give a given lecture on exercise or sleep, I've got to write a note on everybody's participation, and then I bill the MSP, the medical service plan, and no money changes hand between me and the patients. I just love that. And when I do a medical consultation, I bill BC Medical. I don't have to worry that the patient's going to get hit with the bill. And it's remarkable that the government is paying for education on lifestyle medicine. And Elise needed a scan a few months ago, and we went to get one. It would cost a couple thousand in the States, and we just walked right out, and they said, "Have a good day," and no bill. And that's civilized medicine. So I'm really enjoying it. Until the U.S. system gets, I don't know, overthrown somehow. I don't mean to be too radical, but the shifted from for-profit to for the people, where the government steps in. Then U.S. medicine is stuck in the swamp there. So people should agitate to write their congressman, and we want, Bernie Sanders not so crazy as far as Medicare for all. I don't know if we need, but something of that ilk really is required, and we're certainly rich enough to do it. Build 2 less aircraft carriers and fund this program, and people would have never the medical bankruptcies. When people up here hear about that, they're in disbelief. I mean, that never happens up here. It's not an issue, and yet medical debt crushes so many people's dreams back in the States there, and there's no reason for that anymore. And we really need to vote for people who. We vote absentee. We're still American citizens. We vote, but we got to demand for our legislature, we elect people who have a similar vision of medicine for all of us.
Yeah, I agree completely. Yeah, thank you so much.
Mm-hmm.
So curious.
All right. Yeah, go ahead, Kim.
Well, I was going to just say, I mean, are people more open to lifestyle medicine there? And then also you have moving medicine forward. So not only are the patients more open, but are the doctors and the medical students more open? Because you have your project of moving medicine forward, which is teaching medical students. Can you elaborate on that both in Canada and here?
Oh, you bet. Are people more open? Well, I just have to admit right off bat, there's a huge selection bias in that, by definition, people who have come to us at Lifestyle Medicine Clinic are already interested in what lifestyle medicine is focused on, better diet, etc. So of these folks, you bet they're very interested, but again, they're self-selected. But on the TV ads, etc., there's public service announcements about eating more plants and getting out for walks every day, and so the government's generally predisposed. But Canadians, they're no saints as far as personal health goes. And every other page I see, they're obese, and they like their beer, and they like their lunch meats and poutine and Canadian dishes that produce similar effects that the American diet does. So there's no end of clinical material to work with, as they say. But Canadians are in general open to it, at least the ones that we deal with. That again, they're kind of self-selected. As far as moving medicine forward, and I'm so glad we're finally talking about this, in that when it dawned on me, when it really clicked into place, that the vast majority of patients that I was seeing in urgent care clinics at True North Health Center, et cetera, were sitting in front of me in bodies, overweight, hypertensive, diabetic, clogged up, and inflamed from what they're running through their bloodstream every 4 hours with every meal. And and I had a T-shirt saying it's the food. It's been the food all along. That food stream is so toxic that it blows people up and clogs their arteries and creates those disease states. But also, and we've all seen this, we've all been in awe of the powers of a diet of predominantly whole plant food run through the bloodstream day after day, meal after meal, month after month. The transformation that happens is stunning, is awe-inspiring. As overworked as that awesome word is, it really fills me with awe to see the body lose the weight, the arteries open up, the joints stop hurting, the lungs stop wheezing, they turn into normal, healthy people right in front of our eyes here. And that's been the dream of physicians since ancient times, to really rid their patient's body of these diseases. Well, a healthy diet and lifestyle will do that. And so we've got this powerful tool. When you're a medical student, you want to get those medical powers. You want to learn how to use diuretics to make the edema disappear and antibiotics to make the pneumonia go away. Well, this is the most powerful clinical tool any doctor can wield to actually help their patients regain their health on the deepest level. And it's such a powerful tool. About 4 years ago, I was saying, I wish someone had told me this in medical school. It would have changed the course of my medical career, would have changed every diagnosis I made, etiology unknown, nonsense, it's the food. And it would have changed every treatment plan I recommended. And I'm saying, somebody should reach the medical students with this message before pharmacosclerosis sets into their brains and they think that drugs and surgery are the only treatment for these diseases. And somebody should bring this message to the medical students. Somebody, and the little voice on the shoulder said, "How about you, Doc?" And as a result, I began traveling to the nation's medical schools and giving this lecture, what I wish I learned in medical school about nutrition. And as I started, I said, this is the lecture I wish someone had given me 50 years ago when I was a first-year medical student. And we go through, here's what happens to your bloodstream when you eat a cheeseburger. Here's what happens when you eat a salad and rice and beans. And here's what really drives diabetes. Here's what drives these diseases. And by the end, the medical students, their eyes are wide open, and they're all very enthusiastic. And it makes my job easier in that in every medical school class now, there's 20, 30 students. They've seen films like Forks Over Knives. They've seen What the Health. They've seen Cowspiracy. The light's on. But they need a senior physician to stand in front of them saying, this is how medicine should be practiced in the 21st century. And you're not crazy for when it's not California woo stuff to ask about the patient's diet. It's the key to reversing these people's diseases. The concept that these are reversible diseases. I wish someone had told me that hypertension is reversible. We get the opposite message. They will take these pills the rest of their lives. I wish someone told me type 2 diabetes is reversible. Once on insulin, always on insulin. No one gets off insulin. Not only can you get them off insulin, you have to get them off insulin before their blood sugar crashes there. This is an entire revolution in thought of the causation of disease and the treatment of it. And you bet every medical student should know this through all 4 years of the curriculum. I was at the University of Washington, Seattle, and I gave a lecture, and surgeon was up in the back of the room with his arms folded and came down afterwards and said, "A very nice doc, but one till the National Board of Medical Examiners starts asking about nutrition questions on their board exams, we're not going to be teaching this. We've got to really know that it's legitimate and important." And so we said, okay, let's go to the National Board of Medical Examiners and see what they would require to get some nutrition questions on. So the American College of Lifestyle Medicine, the National Board said, make up questions, because we don't even know what questions to make up. So you guys make up the questions, give them to us, and we'll see how many we can get on the board exams, which is nice. I'm hoping they don't take the skin off the chicken questions there. I hope they really get into plant-based nutrition. But at this point in my life, there's nothing more important for me to do. With whatever remaining years I have left, I want to turn the lights on to as many of these students as possible, because some of the medical school faculty said, okay, but if we teach nutrition, the schedule is so chock full of courses that we have to cram into these medical students' head. What do you want us to drop to make room for your nutrition course, doctor? You want pathology, pharmacology? What should we eliminate? And I realized that's a false choice. That's a kind of a cynical way to dismiss it. But the truth is, this is so important, so fundamental, that the effects of the patient's diet should be woven into absolutely every course throughout the 4 years. Certainly in anatomy in the first year, you want to learn the anatomy of the digestive system and the liver. It says a certainly in physiology, how does digestion happen? What happens? How are these nutrients transported to the various organs? Certainly in biochemistry, you need to know the effect of food. But even going in pathology, how can you ignore the patient's diets when you're studying atherosclerosis and hypertension and autoimmune disease? Pharmacology, the patient's diet is certainly going to influence the effect of the drugs. So it should be woven into all the basic sciences in the first 2 years. And then as the medical student moves out into the clinical years, the obstetrics, what should a pregnant woman be eating? What does the standard American diet do to a risk for gestational diabetes, etc. Pediatrics, what should be feeding our children? How can you ignore this? Atherosclerosis is a pediatric disease. It starts in childhood. How can we ignore that? And surgery, internal medicine, every one of the specialties there should, when new patients are presented, the professors should say, and so tell me, what do you think their diet has, what role has it played in creating these medical conditions? It should be part of the entire medical education. So when that young doctor graduates and is ready to go out into their world, even if they do a residency in a specialty, they have an awareness that food, their patient's diet, is the main reason they're sitting in front of you in your office, doctor, and that it holds the key to reversing these diseases. And so the doctors come back, well, that's very nice. But listen, I don't know anything about nutrition. I don't have time to do this counseling. I don't get paid for it. And I tell them, you don't have to, doctor. There are plant-based dietitians who would love to do this counseling for you, and health coaches. They don't even have to be in your same office. They don't have to be in the same city. It works great by telemedicine. So I tell them, so what do they say? What do we do with this? I say, practice in your outpatient clinic or your family practice clinic. Practice good medicine. Be a good doctor. Take a medical history for your new patients. Do a physical exam. Order your labs. Order your scans, and get them on medications if they need it. Absolutely, there's no conflict. But before you let them leave or end the telemedicine consult, say, before you go, I want to connect you with Miss Jones in room 421. She's the plant strong dietitian. She's going to talk to you about what to eat. She's going to give you handouts. She's going to show you videos. She may meet you at the supermarket to take you shopping. You eat like she's telling you, and you come back and see me in a month. Let's see if you're not leaner and healthier, and let's see if we can get you off some of these medications you're on. That's how medicine should be practiced in the 21st century. We've been keeping the dietitian at arm's length as an afterthought. It's I'm a dietitian. But they say, I'm up in the operating room doing real medicine. But what are you doing in that operating room, doctor? You're dealing with the infections and the infarctions and the amputations from what your patients are eating. They're all nutrition-based diseases. And if you can get them on a healthy diet, many of these diseases will reverse on their own. And so every doc needs to, I'm putting this model in their head. So when you get out, you have a connection with a plant-based dietitian who will carry that ball forward for you, and you'll really start getting your patients healthy. It's not that complex. And you don't even have to jiggle the system too badly to do it. I see, I lectured in Massachusetts a few weeks ago, and I Googled plant-based dietitians in Massachusetts who take insurance. And the screen filled up with people now taking insurance there. So it's working its way. You can't you can't keep the hat pin in a cloth bag for very long. The point comes out there, and that's what's happening here with nutrition, especially plant-based nutrition in medical care. So it's an exciting time, but I'm like Johnny Appleseed throwing these seeds out, and hopefully it will land in these young fertile minds and sprout, but maybe not. But I have no control over that. But I think, it's going to become more and more accepted. The public is demanding it. The public wants it. And just the powers that be are holding, there's huge resistance from both the commercial interests, everything from agribusiness to big pharma. But our noble profession is a real bottleneck. If the doctors got on board, what if every doctor said at every visit, by the way, how's your plant-based diet going? It would change everything, and so I really want to, again, get a generation of plant-aware doctors out there so that resistance starts dissipating. And it becomes, of course, I ask them what my patients are eating. Of course, I send them to the plant-based dietitian. When I reach that happy stage, I could go to my grave a happy man and say, mission accomplished there. But I got a way to go before that yet. Got a few lectures to give.
Awesome.
So we love that
Well,
program.
yeah,
Right?
amazing. It's just so inspiring to I mean, I've heard you talk many, many times, but it really is very inspiring. And just so you know, I know I can speak for Kim and myself. We are also on this train, and we are also trying to throw these seeds. And we just need more of us doing it. And I think what you're doing with the medical schools and doing these lectures is one piece of that. But all of us lifestyle medicine doctors need to be a part of this.
Indeed. We're all pulling on the same oars here.
Yeah.
Yeah, absolutely. And everybody can do something, even just talking about it in a positive manner. But I've got a couple emergency room doc friends, and on the back of their business card, there's just a whole bunch of websites, Forks Over Knives and McDougall, etc. And they tell their patients with chest pain and abdominal pain, if you don't want to come back here, flip this card over, check out those websites, and go get your life straightened out. Everybody can do something. And
yep.
So it's exciting, and telemedicine lets us reach a lot more patients. Someone asked about how did the medical school administration feel about this message, and they're not thrilled with it. And seriously, and there's resistance in our profession because this model of these being food-driven illnesses, it shocks or challenges their concept of disease. They're all locked into genetics and environmental toxins, etc., which have a role, but they totally ignore the food thing. And it certainly challenges their their treatment model, their practice model, and having a dietitian in the room, or at least, immediately part of the treatment team. And it obviously challenges their financial model because there's going to be less bypasses and less stents, plates, and et cetera. So they don't want to open that door. They don't want to, it's all California woo stuff. But it's the truth, and real people are dying on real operating tables from operations they don't need, that could be reversed with a plant-based diet. So it's serious business, and I think I'm looking forward to the metamorphosis that our profession is going to undergo. It can't keep this one behind closed doors for very much longer, for sure.
Yep. Yeah,
Yeah.
absolutely. All right.
Mhm.
So let's see. One question that we had, just kind of to finish out with the moving medicine forward, is do students seem more open to your message now than in the past? And if so, can you elaborate?
Oh, absolutely. It's a remarkable time that's happening. Bless these young students. It's a thrill to be in their presence. I do most of the presentations by Zoom nowadays, a left-handed gift from the COVID virus. It forced us to go online, and I'm reaching a whole lot more medical schools than if I had to physically schlep to each one of them. But we are doing a California speaking tour in the fall. We're going down to UCSD, USC, UCLA, quite a number of them, then up to the Bay Area as well. So I love being in direct contact with the students. But the students, absolutely, as I mentioned, here's the first time a real doctor has been in front of them saying that your patient's diet is important and these are reversible diseases. So right away, I got their attention. But nowadays, I must admit that there's more, and it's a healthy thing, but given the shift of the political winds here, we're at a sudden age where bro culture is on the ascendancy, and Joe Rogan and the carnivore diet and the red meat guys are flexing their testosterone muscles there. But I tell the student, but your arteries don't care what Joe Rogan is saying. Your microbiome doesn't care. It cares about what's coming down from the next meal. And if it's full of meat and eggs and cheese, you're going to spawn microbes in that gut that are going to spawn disease in your body. And the truth is the truth. So we have to let it run its course. But, like the Desiderata says, speak your truth quietly and lovingly, and it will carry its own weight. So the students, and it's good and I get in some debates and the Q&As after my presentation. Well, what about the paleo diet? What about my friend went carnivore and their blood sugar came down? What about, and fine, it's good to have that discourse. And so it's happening, but the truth is the truth. We are plant-eating hominids, and the sooner we recognize and act on that anatomical reality, the healthier we're all going to be. So interesting times, but yes, the students are open, and I'm enjoying being with them.
So
if anyone would like to find out more what we're doing, and if anyone feels moved to help us, because it takes money to run all this, please go to our website, movingmedforward.org, like Dr. Scheuer said, and you can read about what we're doing and how people can help if they want to make a tax-deductible donation. Okay.
We'll put that in the show notes for sure.
Okay.
And then in your way of working forward to educate more people, you're writing a book, aren't you?
I am, finally. And surprise, surprise, the title is going to be Moving Medicine Forward. I'm working with our publisher as far as the subtitle, and we wanted to zing what every doctor should be telling their patients, or what every doctor needs to know about nutrition. So we'll come up with a zinger subtitle there. But yes, and you guys don't need to read it. It's no surprises there. It'll be my story of how I came to be on this interview from an erstwhile urgent care doc back in the 70s there. And then I wound up at True North, which is focused on whole food, plant-based nutrition. And I'm it was there that as these patients sitting in front of me, I was forced to visualize what is happening in their bloodstream after they eat a cheeseburger. I asked everybody, tell me your favorite meal. And the litany of fried chicken and pepperoni pizzas and buffalo wings, etc. And so what does a pepperoni pizza do to this person's arteries, this person's insulin receptors? And it forced me to really visualize the pathophysiology behind. No wonder they're sitting in front of me in these bodies. And then it made more sense how a plant-based, lean, clean food stream will reverse all this. And so in the book, I explained that very phenomenon where I take the major 6 diseases that people bring, obesity, diabetes, etc., and explain the physiology behind it. And then the rest of the last chapters are why the establishment resists and what needs to be done about it. And the last chapter, the next last chapter is a day in the disease reversal clinic. And I think every hospital should have a disease reversal clinic, clearly labeled as such. In fact, every doctor's office should be the disease reversal clinic. And I summon up the chief resident on lifestyle medicine, welcoming the young docs for their first day on the clinic at the disease reversal clinic. And here's what I wish my chief resident had told me in my first day in internal medicine clinic. And I have him give this feel, look, we go after the root causes here, and here's what you're going to see, and here's what you're going to do about it. And so it was a fun chapter to write. And the last chapter, I'm doing this book with my co-author, Glenn Mercer, a lovely man. He wrote Food is Climate, and he co-wrote Howard Lyman's book, The Mad Cowboy. He's got a great wry sense of humor, but he's a passionate environmentalist and animal supporter. And he wrote the last chapter. We both did it, but it was mostly Glenn's work on the last chapter. It just so happens. And he's got this elegant discourse on it. Just so happens that the same diet that will clear out your arteries will also help heal the planet, will help liberate the animals from their plight, will help reduce poverty and world hunger, and all of it. Just so happens, and it's a lovely theme. And he starts every line, it just so happens, it just so happens. And just by the time you get to the end of the chapter, it's so evident that we need to make this change, that hopefully something in that book will resonate with both the medical students who read it, especially that chapter 5, and just the general public. Oh, now I get it. Now I get why a plant-based diet and lifestyle is important. So
when will it come out?
Right. I'm racing the clock here. I've got to we got to get the manuscript to the publisher by May 5th, which is just in 2 weeks or so. And then they're going to sit with it a month, edit it, send it back to us. We get a final read through, and it goes back to them. And so by November, December, everything should be locked down. Hopefully it'll show up by the beginning of this coming next year. So stay tuned.
When it comes out, we'll get you back on and say, what did they take out that you wish was in there? And
right.
what do you want to put in there again now?
Inevitably. When I give a lecture very often, after the lecture on the way home, I'm driving, and I get the disease, the condition called the screaming shoulda-saids. And nuts. And I'm sure I'll have them after this book comes out. I should have written, I should have written that. But do the best you can with what you have, and I think it'll be okay.
Well, we have a lot of questions from the audience, so I'd love to get to some of them. And is there anything else before we get to those questions that you should have said during this?
Well, if you're now, again, you've got a self-selected group there. If they're watching this podcast, they know about Love Life Telehealth. But if there are newbies here, please take advantage. The 2 doctors you are watching interview me here are just skilled clinicians, and they offer this beautiful service. And if you need a doctor you can talk to who knows what they're talking about when it comes to food and lifestyle and nutrition, make an appointment to see Dr. Scheuer, Dr. Davis, or their colleagues there. So yay for Love Life Telehealth. It's very important. So Other than that, I'm ready for the Q&A.
All right. So we got, I'll start with the first one and we'll have Niki do the next one. But Cheryl is asking, how much damage are we doing to our gut microbiome with a round of antibiotics? And how can we restore our gut back to perfect health fast afterwards?
Well, I'm sure you two have been following the literature, and we see the winds blowing back and forth and back and forth. It used to be you took antibiotics, oh, you got to take a course of probiotics to replace the bacteria that disappeared. And I used to recommend probiotics after every course of antibiotics. And then out comes this classic study from University of Florida somewhere. It's been 3 years or so that actually that's not a great idea. When they gave people antibiotics and put some on probiotics, some on a placebo to see how long it would take for the microbiome to replenish itself. Actually, the folks who were on the probiotic, it retarded the rebalancing of their microbiome, and so the word got out to them: do not put them on probiotics. Okay, well, I won't put on probiotics, and I'm okay with that because. One, even if you take 5 days or 7 days of an antibiotic, it's not going to just totally destroy your microbiome. There's trillions and trillions of organisms who have been rooted in there since birth there, and they're pretty solidly present there. It unbalances it a bit, but as I tell my patients, the good bacteria, they're already down there, and the bad bacteria, they're already down there too. And the food stream you're eating is like the conductor at a symphony orchestra that brings up the woodwinds and tones down the brass. And if you eat a bunch of sugar, you're going to bring up the sugar-eating microbes, and they are not so friendly fellows. You eat a bunch of meat and eggs, you're going to bring up the streptic oxide that produce TMAO. But if you're eating rice and beans and fruits and vegetables, all the resistant starches and the fiber, that's going to bring up a totally different set of microbes that are much more benign and benevolent. So ultimately, you don't have to do much. Just be honest with your food, get that plant-based food stream going down there, and your microbiome will pretty much take care of itself. I don't think we have to do a whole lot of tinkering around with it. How do my colleagues feel about that? How do you handle your folks on the antibiotics?
Yeah, I agree. Yeah, and I think with going through a round of antibiotics, one of the common symptoms of that is kind of some gut upset. You might have a little bit of diarrhea, and really to replenish that good gut bacteria after, it really is about eating a diverse whole food plant-based diet, right? With different fiber types so that you are replenishing that good bacteria. And I have people asking me that exact thing. Should I go on a probiotic? Will that help? And that's not what I recommend to people anymore. Just like you, Dr. Klaper, that's something that I also learned in residency. Okay, let's start that probiotic at the same time that we're starting the antibiotic. It must help, but it really doesn't. And it really is about the food you put in your mouth that feeds that bacteria.
I agree. I would think the variety, and then also some fermented foods can be a little bit helpful sometimes, but just go low and slow with getting back to, but get back to your regular healthy diet that you had before the antibiotics as soon as you can, and that will help. So.
Great.
All right. And then I think we've got another question. And by the way, our previous question, I know Cheryl very well, so I wanted to say hi to Cheryl. Okay, so this one is from Madeline. And it says, I have very progressed multiple sclerosis. I am aware nothing can reverse it. I am whole food, plant-based, no oil, very little salt. Any suggestions? That's a tricky one.
No, that's more than tricky. Madeline, I wish I could wave a magic wand and remove all these lesions from your spinal cord or brain, wherever they are. And it's a cruel condition here, and a slowly progressive one. And you're already doing what we would suggest for someone who's eating the standard American diet. jump on a whole food plant-based diet and throttle back on the fats. Is a low-fat plant-based diet really is the key. But again, she's oil-free at this point and very little salt, which she should be. We would need to see like a 3 or 5 day food diary. What is she actually eating there, and how much in the way of avocados and nuts and olives and fat-containing food. So you do need a little bit there. So it would be, an analysis might help. And other than that, we need to keep our eyes on the medical literature. I'm sure there are researchers slaving away in the labs trying to find something to get that spinal cord and that nervous system running again like it did and dissolve those sclerotic plaques. But until then, like we were joking before, I wish I could tell you that eat 3 cloves of garlic and wear a rutabaga around your neck for a week and it'll all magically go away. But alas, I don't have any of those kind of tricks in my bag here. If any of you do, I'm certainly. But what would you tell these patients? Anything to offer?
I think you're absolutely right on the diet. This is you want to have a pristine diet, which sounds like you're already doing, but don't forget sleep, stress reduction, things like that. Movement as much as you can. These are all also extremely important. So it's not, the diet is so important, but in a chronic disease like this, it's, making sure that you're hitting all the pillars of lifestyle medicine.
And that movement component is so important. Keep those nerves firing, keep those muscles as strong as you can, keep that balance working in your brain there. Move it or lose it is really true for all of us, but especially for Madeline here.
So somebody asked, any suggestions for a thin, fit woman on a whole food plant-based diet? This is Kipper. Over a decade with high Lp(a) who cannot tolerate statins even at lowering doses, hyperglycemia, severe tendon and ankle edema, and muscle pain with the side effects of the statins. Any suggestions?
Oh my, you've come up with some really challenging questions here. So, this is a larger picture here. This small lipid assassin, Lp(a), has appeared on our radar screens here. And when we're all focused on LDLs and HDLs, et cetera, well, what's with this Lp(a)? And your body can get rid of it. Well, it turns out that Lp(a) is a small sticky particle that does just the opposite of what we would want happening in the bloodstream, where you want that blood free flowing. Lp(a) makes your blood more likely to clot, where we want the plaques to resolve and dissolve. Actually, Lp(a) fosters the plaque formation. And so it can certainly be troublesome, no doubt. And like everything else in medicine, if we see a problem, we take out our pharmacologic hammers and pound down the nail there. But if the person is truly on a whole food plant-based diet, okay, there's more to plaque formation than how high is your LDL, how high is your Lp(a). When plaques form, atherosclerotic plaques form their artery walls, that's the result of a long train of continual artery abuse that the person on the standard Western diet has inflicted upon their arteries with bacon and egg breakfast, after cheeseburger lunch, after fried chicken dinner. They're constantly abrading and chemically injuring the endothelial lining. You're eating oxidized cholesterol in the meat that's working its way into the walls of the artery. You are eating proteins that stimulate the production of insulin-like growth factor 1 that would make the plaque even bigger. It's the entire food stream, like Dr. Colin Campbell wrote in his book Whole. It's the whole food stream and all the interactions that really determine how healthy those arteries are going to be. So the question really isn't, because we can't really lower Lp(a) right now in any decent way. The question isn't how high is your Lp(a), how high is your cholesterol. It's how healthy are your artery walls? Are you forming plaque in your artery walls, or aren't you? If you're not, and there's no reason that a healthy person eating a whole food plant-based diet should develop plaque, I would say because the plaque formation incites inflammation in the artery wall, get your inflammatory markers checked, your high sensitivity CRP, your myeloperoxidase. And if there's any question, get a carotid scan of your get an ultrasound scan of your carotid arteries and see if you've got plaque in your arteries. If your inflammatory markers are stone cold negative and your carotid scan is clean, you don't have the disease of atherosclerosis. It's not creating any mischief. I wouldn't lose a lot of sleep over and chase it with medications that really don't have much of an effect. So it's a matter of total artery health. Again, a whole food plant-based diet should not beat up your endothelium. It should not produce plaque formation. I've only run into 2 long-term vegans who've had coronary artery disease. Both of them were sugar eaters. They're bakers, or fruit juice drinkers, drinking lots of fructose. And one's a baker that can't keep his hands off the vegan cupcakes and muffins. And that will spawn bad changes in your artery walls. But if it's truly whole food plant-based, which vegan muffins and apple juice are not whole foods, there's no reason you should be forming plaques there. So get your arteries checked, keep your diet clean, and if you're not forming plaque, I wouldn't lose a lot of sleep over the LPA, but keep your eyes out. They're coming up with medications to lower it. We'll see. I mean, in the body, you can't do one thing. We're just lowering your LPA. Well, that's what you think you're doing. But meanwhile, what else is happening in the body? We'll see long term whether it's really worth trying. They came up with a drug a few years ago that raises your HDL. Ooh, that's a good thing. But it wound up killing the patients through other means there. So we'll see about these drugs. They may lower LPA. But meanwhile, take care of your arteries with a whole food plant-based diet. Don't eat fried foods and sugars and all those nasty artery damaging foods. And hopefully LPA won't be a factor in your life.
Yeah, I agree. I think, we need to remember to look at the whole picture, right? It's not just about LP little a, like you said. It's not just about LDL. There are so many other components to what are the risks and what ultimately drives cardiovascular disease and plaque formation. And so when I have someone in a similar position as that person did, the position that they're in, I say, well, this just shows you even how much more important it really is for you specifically to continue with that way of eating and with that lifestyle, right? Mm-hmm. Because you unfortunately have that elevated genetic risk from the LP little a, but it should not define your entire risk spectrum, right? Continue doing the healthy things, living the healthy lifestyle. And that really is what makes the biggest difference. It's not just about that one little marker.
And speaking of one little markers, because we are almost out of time, the last question, I have a low white blood cell count and also low apoprotein A1 serum. And I've been told that whole food plant-based diets will have low white blood count. So not to worry. What about the ApoA1?
Oh my. She's absolutely right. Most people are walking around with normal white counts, but they're in the 5,000 white cell range. And when people go plant-based, their white blood cells can start coming down. At least twice a year, I get a call from some panicked patient that my white blood cell count's at 2,900. My family doc is sending me to a hematologist. He thinks I've got bone marrow failure. No, you don't. That is normal. When we eat ground beef and various animal products, the bacteria that are inevitably on the surface of the meat, they die in the meat case under ultraviolet light, and their cell walls break up and release this stuff called endotoxin that is not destroyed by grilling the burger. And so people are eating a standard Western diet are eating endotoxin 2-3 times a day, and they're preying their bone marrow with this highly inflammatory molecule 3 times a day. And as a result, their bone marrow puts out more white cells, and we accept that as normal. Well, steaming broccoli doesn't create endotoxin. So with the lack of endotoxin, the white blood cell comes down. And it's supposed to be 3,100, 2,800. Those are normal white counts, and so not to be concerned unless you start getting infections. That's something else. But if you're otherwise okay, assure your family doctor that you're okay. You don't need to see the hematologist. ApoA1. Is that, and you have a low ApoA1. Again, I think this is another one of these markers. All these studies are done on people eating the standard American diet, and people eating meat and cheese and eggs and bacon, etc. A low ApoA1 can be problematic. But if you're on a whole food plant-based diet and you're keeping your trace minerals up, you really have a balanced diet there. Does this really apply to populations of healthy plant eaters? And I've yet to see that study done. They should take a population of long-term vegans and see what their ApoA1 levels are, and I'll bet they find that again the overall health is excellent, regardless of what that A1 level is. I wouldn't lose any sleep over it.
Well, thank you so much for your wonderful input, Dr. Klaper. I mean, it's an honor to work with you and for you to come on here. And thank you for all you do with moving medicine forward, with your daily education of the physicians and the patients and the community and the world. And I hope that in the future, your dream comes true, because it's my dream. It's Dr. Niki Davis's dream. It's all of our dreams. And so thank you. Niki, do you have any other input or?
Yeah, well, and we just posted the website link, so be sure to check that out, movingmedforward.org, so you can see what Dr. Klaper is working on. And yeah, I just want to say thank you as well for coming on today and speaking with us. It's always a pleasure, and we can't wait to do it again.
And thank you to all of the people who came too, because they had great questions. And Dr. Klaper, the last words.
Oh, just a big thanks to you to making this platform available, for all your great work. You are advancing medicine, a very important frontier, and count me as a colleague, as a friend, as an ally, and a real supporter of all the wonderful work you guys do. So keep it up, and let's stay in touch. All the best.
Lots of love and health to everyone.